Is your baby moving enough? Do you need to count kicks? If you do, when and how do you do that? That's what we're talking about today. I am Rachel Moises, a mother of 8 from the Mighty Mama movement.
And I'm Heather, a family nurse practitioner and midwife.
Okay, so a lot of mamas worry about if their baby's moving enough and if they need to be keeping track of it and what to do. So why don't you talk to us about, first of all, when should a mother expect to feel her baby moving and what is that like?
So a first-time mom usually doesn't feel her baby move until after 20 weeks, sometimes close to 22 weeks. And a lot of times it feels like gas bubbles, some say kind of an indigestion, and it can even be kind of like a butterfly in your belly, and they'll kind of be like,
right, where you think, was that the baby?
Right.
Maybe?
Right. And then moms who have had a baby before, they typically can feel it a bit earlier, sometimes as early as 16 weeks. But once again, it still feels like the butterflies, little gas bubbles, that sort of thing.
Mm-hmm.
Yeah. And every mom's going to vary. One thing that can affect it is, where is your placenta? If your placenta is in front, you're not going to feel it as much. Compared to the placenta in the back, just because it kind of acts like, a soundproof padding on the wall.
Yeah.
So when that placenta is up front, so you don't feel it quite as much then. So you might feel it a little bit later and not as intensely.
Okay. And when you're early on in your pregnancy, it's like, let's say earlier, a little later on than when you're just barely feeling it. It doesn't start feeling like kicks until you get further along. So if this is your first pregnancy, you're kind of wondering, like, what is it like? When your baby gets bigger, you feel like they're trying to escape. They're pushing against you sometimes, and you can sometimes feel a leg or a knee or hand or whatever. But when they're younger and they've got room to be somersaulting around in there and just bouncing off the walls, it just sort of feels like that.
Exactly. And around 30 weeks, give or take, that's when baby's going to be the most powerful, because baby has a lot of room still, and their arms and legs are getting more strong. And so that's when moms really feel those big kicks and those big movements and stuff like that. So that's when you're really going to be like, oh, there's a foot.
And then later they get more cramped, so it's not so... They're not having so many gymnastics practice in there.
Yeah, it's more bumps than full-on kicks or punches. Yeah.
Okay. All right. So the big question here is, as you progress through your pregnancy, do you need to pay attention to how much your baby's moving in order to make sure that everything's fine and healthy and there's no concerns? So what do you teach your clients to do there?
So we usually have them start around 34 weeks. Paying attention to what we call fetal kick counts. Okay. And how we have them do that is, I tell moms, Kate, the same time every day, you need to be sitting down or laying down. And I explain it that way because when you're up and moving, you're rocking baby to sleep. And so when you're sitting, you stop that rocking motion. Plus, when you're walking, you don't feel the movements as much as when you're just sitting there quietly.
Right.
So same time every day. So why do we need to do the same time? It's babies sleep in short sleep cycles in 24 hours, where if somebody bugged us at 3 a.m, they think we were dead, because we're not moving at 3 a.m. And so I tell moms, notice a time when baby is regularly awake. Let's say that's 5 p.m. Okay. You notice that baby's doing acrobatics at 5 p.m. So every day at 5 p.m., you're going to sit down on the couch, chair, whatever, and you're going to see how long it takes to get 10 kicks. Now, hiccups do not count as kicks. Do you know why? Can you guess why?
I do not know why. They're involuntary?
Exactly, because a hiccup is involuntary. And so we want those voluntary movements. It can be a large movement, it can be a small movement, it just can't be a hiccup.
Okay.
And we have them do that 10 times. Now, they used to say 10 movements in an hour. And they stopped that because if your baby normally at 5 p.m. every day does 10 movements in 6 minutes, and now it's taking an hour, that is a big problem, because that is taking 54 minutes longer than it normally should. And so they want you to go off of your average and then take it from there. So once again, we're doing it at the same time so that we know babies awaken sleep cycles, because they can be like, babies nap for like 20 minutes at a time usually. They don't nap for 8 hours like we do, sleeping. And then we want to see, okay, what is baby's active cycle? Is it normally 30 minutes? That's totally fine. But once again, if it's taking 2 hours to get those 10 kicks where it normally would take 30 minutes, then that's a problem. So when a mom calls me and she says, hey, it normally takes, let's say, 30 minutes to get 10 movements, and it's been over an hour and I still haven't felt anything, then I tell them, go drink some juice, something to kind of get that quick rush of sugar. So we don't want like a donut, that's going to take quite a while, but juice is very, very quick to give that sugar. So I want them to drink some cold juice, the cold helps, and wait 15 minutes. And usually within about 5 or 10 minutes of doing that, baby's gotten that sugar through the placenta and now they're awake and they're going to town. If that still doesn't bring on those movements rather quickly, wake baby up, then I have them come in and we do a non-stress test and see what's happening with baby's heart rate.
Okay. Yeah. So how many days does it take when you first start this at around 34 weeks before you feel like, okay, I've got my average? Like just a few days, a week? I
would probably do, a week, but you'll know pretty quickly, because where it's going to take a little longer is if you have 6 minutes one day and 30 minutes the next day, and then 15 minutes the next day and 40 minutes the next day, then you've got to kind of find that average. But most women will tell you within a few days, they kind of know.
It's pretty consistent.
Yeah.
Okay.
Yeah, as long as they stay to that same time every day. And some women will be like, I don't sit down and take that time out because I felt baby moving all day today. And that's fine. It's when you haven't really felt baby move. Let's say you're doing a job that you just aren't paying attention to that.
Yeah, then I haven't noticed.
Exactly. That's when you need to sit down and say, okay, I need to pay attention now.
Okay.
But when you felt baby moving all day long, don't even stress about it.
Okay, so at first you want to establish your sort of average, your status quo.
Right.
And then if you have a day where you're totally noticing movement, you don't have to do it, but you want that average to sort of measure against for the days that you do need to sit down and pay attention.
Correct.
Is that okay?
Yep.
So not necessarily every single day. I'm just curious, why do you have, it makes sense why you have a mom drink juice and give the baby a sugar rush. Can you just try to wake the baby up?
You can.
Hello, we're moving right now.
You definitely can. You can definitely, just try to jiggle baby and wake baby up that way. But if that isn't working, then that's when you need to go for the juice or something like that.
Okay.
Because we'll do that in prenatals where I want to hear that acceleration in the heart rate. I'll kind of grab baby's bum and kind of jiggle baby's bum. And I want to hear that heart rate go, ooh, someone's jiggling me, someone's playing with me. Yeah.
Okay, so you mentioned one scenario where this is concerning. Are there any other scenarios where you're like, oh, you got to contact your healthcare provider and go in to get baby checked?
So really just not, there's a whole bunch of other health issues, but pertaining to this, you just can't get baby to move well at all. Or they just do one little kick and then they're like, just kidding. Like, that's too much energy. And you need to look at that and get it taken care of. And don't just think, oh, it's 5 p.m. I haven't really felt baby move. I've tried these things. It's not working. I have a doctor's appointment tomorrow. I'll just, or midwife appointment. I'll just go in tomorrow and I'll tell them about it. When you don't feel baby moving for an extended period of time, you have less than 24 hours if baby is in trouble, if baby truly is, you have less than 24 hours to get baby born if baby's truly compromised. And so it's not something that you can say, I just have an appointment tomorrow, I'll just wait until tomorrow. You need to jiggle baby, you need to sit down so you're not rocking baby to sleep. You need to jiggle baby, kind of move baby with your hands on your belly. You need to drink some juice. And if that doesn't get baby moving within the hour, then I would definitely call your provider and get looked at that evening.
So if that's all the case, then it is really important to take the time to sit down and pay attention to baby's movement. Personally, with my pregnancies, obviously sometimes the baby's moving a ton, like you said, and it's just like,
Right.
yeah. But a lot of times I'm just so busy and distracted with other things that I haven't paid attention. So I really just,
Right.
has the baby moved today? Probably. I don't really know. So that's where it's important to be consistently take a few minutes to sit down. It could be
Right.
when you relax before you go to bed, I'm assuming.
Yeah,
When you're
exactly.
already kind of settled down and thinking, okay, I'm going to relax a little bit before I go to bed. I'll pay attention right now.
Yep.
And you're just trying to get 10 kicks in a reasonable amount of time compared to what's been average. But if not, then you start paying closer attention, try to get baby to move. And again, if not, that's when we're going in to get checked.
And, do try for 1 or 2 hours, as long as you get the occasional kick. Do try, because you may have hit a sleep cycle that babies just change their sleep cycles a little bit. And so you want to give baby that chance to wake up and such like that. But after you okay, it's been a couple of hours, nothing is changing, I've done things to try to make it change, then you need to get help.
All right, so you said to start doing this intentionally and regularly at 34 weeks.
Right.
What before that, do you have to do it at all or not worry about it?
You're not worrying about it too much. As long as you're just feeling baby move throughout the day, you're getting those occasional movements, you're fine. But you don't need to sit down and be like, okay, I need to do these counts. Has baby moved 10 times? You don't need to worry about that as much before 34 weeks. But if you've noticed, hey, let's say you're 30 weeks, I have not felt baby move at all today, then I would sit down and do it and just make sure that, baby is moving. But you don't have to watch it as closely. The chances of something happening before 34 weeks, I mean, obviously anything can happen, but it's very rare compared to the further you get in pregnancy. And the reason we're looking at it is the further you get in pregnancy, the placenta starts to age. It starts to shut down. So baby doesn't get the same level of nutrients or oxygen exchange. And that's what we're looking for. Where a placenta shutting down at 30 weeks is pretty rare. It happens, but it's very rare.
Right.
And so after 34 weeks, especially when you get 36, 37, 38, and definitely if you're going overdue, then we want to make sure the placenta is still functioning. And that's the purpose of the fetal kick counts.
Oh, okay. Yeah. All right. So you could do it anytime you want for the peace of mind, especially like we said, if it's one of those days where you've been distracted and just think, haven't really noticed the baby moving.
Right.
Most likely baby has been moving. You just haven't been paying attention. And so sitting down and paying attention for a little while will reassure you.
Exactly.
But just in case, in case it's not, then you would be alerted and know that you need to take action.
Exactly.
Okay. Well, if you have any questions about that, comment below and we will answer them. And remember that we have a free online birth class called How to Give Birth with Practically No Pain. So if a practically pain-free birth interests you, then check that out too.